Your smile tells the world a lot about you. It can show that you are happy, confident, successful. Not everyone is born with a great smile, but thanks to modern dentistry, a new smile is within reach of just about all of us. People just like you are choosing to get the smile they've always wanted. But it's not easy for everyone. Many people are not getting the dental care that they want and need. People have many good reasons for avoiding the dentist. Some people are afraid of the dentist or just uncomfortable with the whole process. Others avoid getting the care they need and want because they just don't have the time for multiple dental appointments. If this sounds like you need to know that you're not alone. The good news is that for many people just like you, the answer may be sedation dentistry. At Newman Springs Dental Care, Dr. Mitchell Friedman treats hundreds of patients every year with sedation dentistry. Dr. Friedman has served patients in New Jersey for over 20 years. His extensive training and experience have earned him authorization from the New Jersey Board of Dentistry to administer oral conscious sedation. Dr. Friedman and his team at Newman Springs Dental Care have successfully and safely treated over 1,500 sedation patients. Sedation helps patients to be comfortable and relaxed during their dental appointments. It's one of the latest innovations in dentistry, and patients love it. Comfortable and relaxed are not normally words that come to mind when people think about the dentist, but in this video you'll see how Dr. Friedman and his team use sedation to actually make the dental visit a pleasant experience.
People seek out sedation dentistry for many reasons. The most obvious one is fear, painful past experiences. But another very common one is the time issue. They've been away, they might be on the road as a salesperson, and they say, you know what, I want to get this done, I want to get it done in the fewest number of visits possible in one place, and we're able to offer that to them. We see people every day who haven't been to the dentist for 2, 5, 10, maybe even 20 years.
Lynn was one of those people. She had neglected her teeth for years until her daughters finally talked her into visiting the dentist.
Well, I was always very nervous. I would get very antsy knowing that I had to go to the dentist. If my teeth bothered me, I would put it off until like the last minute, to go, until it was so much more than it should have been. I would put it off because I just didn't like to go. And that's how I have been all through my life. I had an experience with a dentist where the drill was caught in one of my cavities, and he pulled it out. This was when I was a child. He pulled the drill out of the tooth, and the drill came back and went right inside my cheek. The condition of my teeth were very discolored. Very yellow, not very attractive, and there were teeth that were out of place. There was an overbite. The whole appearance was not attractive at all. And it had been, oh my goodness, it had been at least maybe 5, 6 years since I had been to a dentist, and the only reason I had been to a dentist before that was because of an emergency.
She was beautiful, but every time she opened up her mouth, it just aged her 10 years because her teeth were just, just crooked. And we kept saying, you need to do your teeth. Your teeth would make you look so much younger. So I think finally, after years of harassing and mocking, she finally went and had them done. And I mean, her mouth, she's beautiful now when she smiles. Her teeth look so nice instead of looking like someone hit her with a sledgehammer in the mouth, which is what it kind of looked like.
When people come to me for the first time, many times they'll be sitting covering their mouth, having their chin down. They're just too embarrassed to smile. They're too embarrassed to speak. Their children haven't seen them smile in years.
Oh, well, it was the kind of thing where everybody would be smiling. My girls all have nice smiles. I'd be the one with the hand over the mouth or, looking the other direction. And, here my girls have beautiful teeth, and I'd be the one with very stern. And it always looked like, didn't you have a good time at that, when that picture was taken, because I didn't smile.
Very often, The people who come to us have a myriad of problems. Almost universal with them is periodontal disease, painful teeth, infections in their mouth. What they see is a broken tooth, pain, and discolored teeth.
There were times where I would be very much conscious of, photographs. I mean, somebody whip a camera out, and, my smiles were all with my lips closed, that kind of thing. And if I was talking to somebody like at work, at a meeting or something, just, you sit, I guess everybody has their good side, their bad side, so you try to sit. So this gap over here isn't the most pronounced part that people are going to see.
I didn't like smiling. I would see pictures of us at Christmas, and my teeth just looked almost grayish. Not so bad, but they looked grayish, and the two front ones were turning. I remember being in Mass when I was younger. We were in the 2 pews or 3 pews, all of us, and my sisters would go like this to me, because my teeth were crossed a little bit, just a little. And so growing up, it's those things that really will cause your phobia.
It takes so much courage because so many of our patients have stayed away for so many years. They're so embarrassed. They're so afraid of being judged by the dentist or by the staff.
One of the things when I first came in, and one of the things that had kept me from seeing a dentist all along, was the fear of the judgment of how did I get to this place, and how did I let this happen to my mouth and my teeth, and it's all my fault.
It's very common that what keeps people from coming in or even making that initial phone call is fear of being criticized. They already feel guilty. They know what they're supposed to do. They just want someone to know that that's how they feel, and we'll take care of them. No judgment here.
My teeth were a disaster area. There were 18 or 19 left, a number that had been extracted, and I just had holes where they used to be, broken teeth, molars that were broken, just little pieces of them left, and pieces would fall out when I would eat.
I would hide my smile. I would see pictures of myself and say, oh my God, I cannot believe those are my teeth. And it wasn't really that horrific, but in my mind it was.
My teeth were in very bad condition, and when I first came here, I was expecting to just really find out about getting false teeth, because I thought I had reached that point in my life because they were in very, very bad condition.
Sometimes people come in with pain, and once they're here, we can say, we're going to take care of that pain for you, and we're also going to take care of some of the other problems before they become painful for you. And then we can get you back to dental health and hopefully have a better experience at the dentist and want to come in for health reasons rather than just for discomfort.
So tell me, what brings you in to see us? How can we help you today?
Discomfort and cosmetic concerns aren't the only reasons to maintain your dental health. Many people don't realize that oral health impacts their overall well-being. Periodontal disease, broken teeth, and oral infections can cause complications in pregnancy and exacerbate the problems of diabetes, heart, and kidney disease. Missing teeth can affect the health of not only all the surrounding teeth, but also the jaw. When your ability to chew is impaired, your digestion can suffer as well.
Many people complain that once they start trying to get their mouths back to health, they have to go to many different dentists. They have to go to an endodontist to have the root canals done, an oral surgeon to have extractions or implants placed, a periodontist to have periodontal treatment. We try to take care of everything in one place, and also to get as many things done in as few visits possible.
If you have neglected your teeth for years, whatever the reason, you'll discover that a visit to Newman Springs Dental Care is different than anything you've experienced in the past. Oral conscious sedation allows patients to receive care while in a quiet and restful state of mind. It is effective and it is safe.
Oral sedation basically is giving oral medications to patients to help them relax. And 99.9% of the time we're giving drugs from a family called benzodiazepines. The prototype of that family is Valium. These drugs have been around for well over 40 years and have a proven track record for safety. Every state provides guidelines for the use of oral sedation in the dental office. The training that dentists usually receive involves pharmacology, emergencies, equipment, and general patient management when their patients are at the dental office.
Conscious sedation is very different from IV sedation if patients have had that in the past. You have control in conscious sedation. You can respond to stimuli. If I ask you to open your eyes, open your mouth, you can do this. If you have a problem, if something's bothering you, not feeling right, you can let us know about it. But what's very interesting is you let us know in a very calm, relaxed way. This doesn't feel right.
On the continuum from fully conscious to unconscious, there are many levels of sedation. Oral sedation fits in one of the lightest levels where patients are conscious, able to respond to us, tell us if they need to go to the bathroom or if something hurts, but they're also very relaxed and able to receive the care that they need.
When you call Newman Springs Dental Care, I'm the first person that you'll talk to, and I'm the first person that I'll greet you when you come in and help you with your paperwork, and also help you to get the treatment that you need, and help you get your treatment financed so that you can so that it fits your budget, and you can get all the work that you need to get done.
The first thing we need to do is deal with the broken one, clearly.
The goal of the first visit is usually to arrive at a diagnosis and formulate a treatment plan. If a patient is in pain, medication will be prescribed. It is not uncommon for patients to feel anxious on their first visit.
Dr. Friedman's staff came in and called me back. I was literally shaking. My heart was pounding out of my chest. And I knew it was a reactive anxiety. I'm in medicine. I knew exactly what was going on with me. And he just came in a very reassuring way, grabbed my hand, very warm. Lisa, it's going to be fine. Everything's going to be fine. You're going to be all right. And that was my initial visit with Dr. Friedman.
When cosmetic work or restoration of missing teeth is necessary, Newman Springs Dental Care offers a computer program called Smile Vision.
Oh, Smile Vision's great. It enables the patient to see what their potential smile can be. So it's really a simulation. And we're able to send that to the patient. We email it to the patient after about a week after their first visit, so they can see what their new smile is going to be like.
He presented me with pictures of what my teeth were going to look like and what I was going to look like. And believe it or not, it was perfect. So I said, that's what I want to look like, and that's what it came out like.
Prior to even making any decisions, he will print out on a computer printout exactly what your teeth will look like. And he'll tell you, you don't want them to be exactly perfect, because then that looks fake. They look false. And he is absolutely right, because I thought I was going to go in and just have perfect line of teeth, but my teeth are very, very real looking. I've never had, every time I smile, somebody's coming up to me and saying, oh my God, your teeth are fabulous. Friends from grammar school are still saying it. They see me and they're like, what did you do? What did you do? Oh my God, you look fabulous.
Newman Springs offers many ways to improve your smile. One popular alternative is Lumineers.
We're proud to be a Lumineers certified dental office here, which means we can do smile makeovers using veneers without having to grind down the teeth. And traditional veneers that have been around for many years involve shaving down the teeth to get the veneer to adhere to the tooth structure. And with these Lumineers, we can get away from drilling on the teeth. And the Lumineers are made out of a very thin porcelain, almost as thin as a contact lens. And they're bonded onto the teeth without having to drill on the teeth or give shots and numb the patient. So they're a great alternative.
Commonly, the first visit, we want to make the person as comfortable as possible. We don't want to, if they're in pain, we don't want to make it worse for them. We normally take blood pressure, review their medical history. Everything we use in the office is digital. We take digital x-rays, digital Panorex, which is a view of the whole head. We take intraoral camera photos, which is basically